Good morning, everyone, and welcome back to this morning's conference. Debate number 9 is called Investing in the Health Sector. Is it safe? And I would like to call on Maëlys Ferrer, Thomas Landrin, Cécile Réal, Cyril Chiver, and the debates will be moderated by Elisabeth Hubert. Elisabeth has a very hoarse voice, and if she needs my help, she'll call on me. Good morning. I apologize. I've lost my voice. It's going to be complicated to moderate a debate. If you believe that this is due to a night of partying, I would like my friends to say that this is not the case. But please be reassured that I'm not going to try to speak instead of the guests. I will leave the floor to them, even if this topic is quite an interesting one and could necessitate some debate, as interesting as the debates yesterday, which proved the complex links that exist between money and health. Doubtless, we're all here slightly masochistic because we're involved in this world that we often criticize its problems. Some are more involved because we work in this field and invest in it also. They invest sometimes their own money or the money of people that have entrusted them with this money. So yesterday we heard that earning money in the health sector could be equated with a sin, according to Luc Ferry, unless it's redistributed. Other speakers insisted on the fact that the engagement in the health sector had to have meaning, and can you give meaning and earn money at the same time? And is it right to earn money on disease? And on the other hand, we always need more and more money in order to find new drugs and to treat people and to find new technologies, and we have to deal with this paradox. So we'll have some speakers who will shed light on this topic. It would have been interesting also to invite to this round table other stakeholders, investors in the health world. I think in particular of those who invest in building clinics, who set up groups of private hospitals, or who propose to buy public hospitals, the structures, as was explained in Germany, the case in Germany where they took over the hospital, and they explained why they were investing. So through this round table discussion, we will try to continue to focus on investment in health, even if that's only part of the whole, which also includes treatment and medical devices. So I'm going to stop my introduction here. So I hope I didn't contaminate you yesterday, because in that case, you're going to have a very unpleasant weekend losing your voice too. I'll start with Cécile Réal. Her experience is very interesting. I didn't introduce the 4 speakers, but you have their biographies on the documents. But Cécile Réal's career is an interesting one. At 25 years old, she created her own company in medical devices. And so the question could be, why at that age did you decide to invest in this field? Why, Cécile? I was unaware of the difficulty developing an implantable Class 2 device. At 25 years old is complicated. You don't necessarily know all the paths. But more seriously, I'm a biomedical engineer. I've always wanted to work in the health sector, and I was lucky early on to work with very great surgeons, especially cardiac surgery, who passed on their passion to help patients and to find solutions. And the engineer-surgeon team is essential for this, to develop solutions. I work in a surprising company, a nuclear company called Cogema, that had a small biomedical department where we were developing applications, particularly new biomaterials, and we decided to use them not only in cardiac surgery, but in other types of surgery, and we got some very good results with our implants in orthopedic surgery. And then I decided to change because they weren't really keen on investing in health. They didn't want to hear that health could kill twice. So it wasn't sufficiently interesting for this company. So they decided to stop this line, and so I was asked if I wanted to take on this project So after having met with some large groups, I decided that the situation was quite atypical. We were at the beginning of the development of this new technology, and we weren't at that stage interesting enough for a large group. And I turned back to my boss, and I said, I did find a buyer. I would like to buy it. That was my assignment, to find a buyer for this division. Did you find people to support you financially? Was it complicated? Yes, it was actually fairly easy. We got private investors interested. They wanted to invest in the project. They were individuals, yes. There was a business angels were only starting, but in 2000 we were lucky enough to have some articles written about what we were doing, and some people got in touch with us and said they wanted to invest in our project, and that's how we started to develop. Very quickly we developed internationally because it was complicated. It is still complicated to sell innovation in France. We'll come back to this. And so we quickly called on French institutional investors to continue our development. We developed a network in 20 countries, built a plant. This is very interesting. Cécile talked about institutional investors. Maëlys, you work at the BPI France, a venture fund company. The BPI didn't exist in 2000. It had a predecessor, the investment funds, even if they didn't have the same objective as BPI. Would you have helped Cécile in 2000? Well, I didn't. The company didn't exist at the time. Would you have helped a young 25-year-old woman with a project of this type? I think that financial organization at the time was not as developed as it is now, but there were private stakeholders, institutional investors, and public intervention or investment was quite limited. It developed really after the last economic crisis. And this is in parallel with my own professional career. I joined the Strategic Investment Fund in 2009 after the Lehman Brothers crisis, and all of the financial actors were all in difficult positions, particularly for the financing of startups. And the financial markets were really at their lowest levels at that time. And so that's where we could ask the question, why do we need a public investor, and what can they provide in addition to what a private investor could provide? The public investor intervenes when the market is not performing properly, when there are economic crises, and they're there to support investment efforts and to provide leverage to private companies. I didn't answer your question. That's true. And are you not chasing after success? Do you have to have already do you have to be on the path to success to get you invested? Do you have other investors? Well, couldn't you be one of the first investors rather than waiting for other investors, private investors? Well, that can exist. There are mechanisms where the state provides seed funding, where there are very few private companies that get involved, and the state can play this role. It's a bit more delicate, but then there's another death valley afterwards where the capital needs are so high, and there's still a high risk profile. And so you can't forget that you need support mechanisms throughout the financing chain, because when you help at a given time, if you don't continue your efforts, you can have companies that might fail and might not bring their product to market. I thought my microphone had died after my voice had died. So Cyril is the president of an American company, MSD. the question, was it wise to invest in health? I think the answer is obvious. It's in the question. Should big companies, not MSD specifically, there are others here involved in medical devices, should big companies like yours not be available to help smaller companies get started? If we extrapolate to what's being done in terms of medication development, do you not tend to focus on the big markets where you know that there'll be a medication that will be widely sold? And how do you work with small companies that could grow in future, but that at a given time need financial backing in order to develop? Do you do that? Yes, we do that. We do it a lot because it corresponds to the change in the research model. You use the money that you've earned in the past to invest. Well, we use money that we've earned and we invest specifically for the future. So our work is really focused on innovation. We have an idea of what innovation is. And if we look at the past, if you look at the past as a linear path, innovation has a father and a mother. And today, innovation is no longer linear. It comes from all over. The innovations of today and the innovations of the future will have several fathers and several mothers. And this reality is due to the fact that the scientific frontiers are shifting. It's almost impossible alone to bring innovation to success. We have 7,000 researchers that cover many topics. We're in the top 100 on many topics in terms of the number of patents that have been filed. So 7,000 researchers in-house. How many outside? In China, we work on certain technological possibilities. So how many people are there outside working on that? What really drives us now is not the paternity of the innovation, but how we can work together, particularly in the more upstream phases, to create partnerships of different types, sometimes buyouts. We work with universities, with biotechs, with startups. So we support them. You talked about seed funding, seed financing. I was in Canada before I came to France, and we were a stakeholder in an important fund, a large fund that we created with 3 others called Amorchem and with the government of Quebec. What Amorchem does is they look for projects that are in a preclinical phase at the university, in universities or startups, and they try to bring them to the next stage. That's a possible route. In France, we launched a fund called MDS Avenir, where we want to set up public-private partnerships with big research centers to really drive science at basic research and turn it into translational research. So that's a good use of your profits, but by doing that, are you reducing your risks? Because you're selecting projects, I believe. You select the ones that you're going to work with and that you'll support in their clinical development. So at the end of the day, you're really reducing your risks. The risks that there could be with the release of a product. I see you look surprised. I'm coming back to Yves Juillet's roundtable discussion about the price of drugs, how you calculate that. And that leads us to challenge this model. You can see the interest of large groups in accompanying startups, in working with small companies. That's great. But in the end, there's an interest for them, but also an interest for you because you're reducing the risks that you're taking. I don't think you can ask the question in that way in terms of risk mitigation. I think that we're really talking about being able to drive science forward and to find solutions to a given problem. I don't think it's a question of risk mitigation. I think that the payout for all of these stakeholders will be based on the risks that they took. If you look at the more upstream phases with biotech companies, universities, and other organizations, there are different mechanisms that make it possible to value their contribution depending on what was discovered and the risk that was taken. The biggest risk, and this is where we need the capital, starts at the clinical study phase, phases 1 through 3, and we're taking those risks quite clearly. So we can't ask the question in that manner. So I turn to Thomas now. You work in a different type of system. You set up a community-based system. When I read about what you do, I'm wondering if you haven't reinvented the model, but what has led you to work in this way? When we hear what Cécile went through, what the BPI does, the way big companies say that they're working, how come you didn't find what you needed, what led you to start this initiative, La Paillasse? La Paillasse has a very specific story. It was an experiment in and of itself. 5 or 6 years ago at the time, I was a researcher. I was working on my PhD. Everything was going quite well. I liked what I was doing in my research work, but I was a bit frustrated, like a lot of young researchers are, because we have very little autonomy. It's very difficult to find topics that are not in line with the topics that the lab that you're in is working on. So it can be complicated to work differently and on different topics in these situations. So the way in which we do science, the way we do, it's not the monopoly of academic research. We wanted to work differently, so we set up a different laboratory with friends. We didn't have any resources at the time. We sent this up in the basement of in Vitry-sur-Seine of an old building, and we equipped this lab with machines that we recovered from the garbages of labs. And it was cost us nothing, and it was better equipped than my own university research lab. So we wanted to do free experimentation in the lab, and to our great surprise, it was a fabulous experience. It changed my life. To be able to see that there are a lot of people, mostly non-biologists. Well, you don't only work in health, no, but it's mostly a biology lab. So there were people with the intuition. We thought people with this intuition of biology would come. No, there were lots of different engineers with different skills, sociologists, artists, citizens who didn't necessarily have a very high level in terms of their science skills. They all got together, and we realized that we had all the skills we needed in the same place to do what we wanted to do. And so we launched ourselves in many different projects, and we did low-cost genetic testing. It turned out to cost €5, and thanks to that, we could detect what was in our plate. We had the problem with the horse meat in the lasagna in France. And lots of people were asking questions, but people couldn't get answers easily. So it was a bit paradoxical at the time of internet, when we have real-time access to information. We couldn't even know what we were eating, what was on our plate. So we did this. We shared an online protocol. It was recovered by many people, and now it's being used in many different places. It's called Quick and Dirty DNA detecting, and it was even published in a peer-reviewed journal. So it was an interesting methodology, and it was so inexpensive that we used devices that we had bought in the supermarket to do the extraction of the DNA.
So you're saying that you didn't have very much money, that you needed men and women and ideas. The idea was to show that we could do science and research differently and for a lower cost. After that, we worked on scientific equipment. Scientific equipment is very expensive. So accessing technology is costly and prevents most of society from using it. So we've seen what the digital technology revolution has enabled. You can buy a computer for $100 or 100 euros. The number of people who can use this kind of equipment and be entrepreneurial is considerable. Why not do the same thing, therefore, with technologies like biotechnologies? For that, you have to have lower cost equipment. So we worked on basic equipment like centrifugal machines, PCR machines, transeminators, bioreactors, and machines that were totally open source. In other words, all of their plans and operating instructions were open source. So anybody could contribute to what was being done with machines. So the plans were on the internet, other people used them, built the machines. So it was fascinating. There was a widespread movement. We worked on biomaterials. We're lucky enough to have with us engineers, biologists, and designers. So we worked on new ways to make textile based on bacterial cellulosis. Or we looked at biodegradable electronics with engineers from SUNY. We found that melanin has semiconductor properties, and we looked into yeast so we could make thermal sensors. We worked on inks that we could produce based on bacteria, because bacteria produces ink-like substance. So we saw over 3 years with about 50 people, we saw that we could make some incredible things. And that was what motivated us. And then we looked at scaling up. So benefits, profit like this, yes, it's very surprising, incredible, very instructive, the model, because the question that an investor might ask is, what about intellectual property? Where is the intellectual property? How can you capitalize that? And what is the business model? What is the business model that might come out of it? Or perhaps that's not the main aim. No, ask your questions, very good. Those were the right questions. Yeah, well, at the time, in fact, we're not in the basement squat, the squatted flats basement anymore. But at that time, there was no business model. Everything was free. We connected up to the railway network for our electricity. So that's very disruptive then, this kind of experience. And people worked during their free time. So perhaps you might have had some problems with that, no? By connecting up to the railway network for electricity. Anyway, the environment was very specific, let's say. But at the same time, if you came into this space, if you'd seen the space, you would have been struck, because there was so much diversity that you can't find anywhere else. So the question is the business model, because, the title is to invest in health. Okay, this experience, how did it lead to something that can be part of the future of research? When we arrived, after 3 years with the results, we wanted to go further. So we said to ourselves, okay, we've got the seed of something that can become an alternative business model. So we had to build a business model thanks to that. We wanted something that was scalable. At the time, again today, most of the projects were open source. So there was no intellectual property. We had a collaborative open source approach, so people came to work on general interest subjects in their free time. Today, we've transformed the model. We've got an 800 square meter laboratory in the heart of Paris, Rue Saint-Denis, with a team of 11 people working full-time, managing all of the activities. And who finances all of that? I'm coming to that. Yes, I'm very interested. So today we can accompany 50 to 60 people on a permanent basis. So we've become a kind of incubator, if you like. We've got about 10 startups that are in place, but also many students' projects. We have many freelance people and many research projects. Now, how do we go about all of this? The Payas business model is at local level. We focus on co-working. So people who come to La Payas, they pay something as if they were going to a co-working space, buying a chair or a table or a light. Here they have access to a laboratory, but it's the same price as a co-working price. How do we do that? Over 80% of the equipment has been recovered But of course, now we have multiple partnerships, and so laboratories call us before they actually throw their machine away. So you have to realize that there's such a big turnover in laboratories, whether they're private or public. There are many machines that are still working. So these people don't need them anymore. What about the people who are permanent staff? Who pays them? We pay them. Co-working pays for the salaries. It's 800 square meters as well. We've got to pay for that. And then there are lots of partnerships. We've created scientific programs. We've created research ideas with partners. The last is an open source research project called Epidemium with Roche. So the idea is to show that we are able to have this massive mobilization just using open data and open software, open tools. We can have this massive mobilization of high quality contributors with lots of skills who can work. And so they do with you what they do elsewhere in academic research, for example. Yes, but they're not just researchers. We wanted to work outside of the academic world as well. Cécile, could you react to what Thomas is saying? You created your company. You then created others afterwards. So what do you see in this approach? How is it similar? And what difficulties did you encounter yourself? Given what Thomas has told us, when did you know that you're going to be facing difficulties and you had to turn towards outside people to sell your company and make sure that success happened, but was different? Well, there are several stages. Are we talking about medications, medical devices? The challenges are different depending on whether you're in the clinical phase, which is very complicated and full of risk. For other types of devices, you can have the financing in the first phase. I believe very much that we are in a marvelous period in terms of technological convergence or even emergence. I don't think that today that we've got silos, biologists, engineers, doctors, apart, separately, they can't find the solution. So we've got to have more of a mix, and that's why we're finding solutions to some very interesting challenges. Today, financing the first phases of this kind of experiment, well, you have to take into account that we're in a great country. For doing research and development in France, today, we've got the GUI, for example, and then you've got to think about the next phases, and there are initiatives, there are things that are interesting, there are entrepreneurs who want to reinvest their time and money and help with new projects, and they make themselves available to such projects. So in the round table, we heard about a lack of visibility, lack of too much bureaucracy. Yes. But in the later phases, once you have a product that is ready, coming back to clinical development, it's not easy in France. We've got the problem of visibility. We don't know what the times are going to be, how long it's going to take. When you've got a small company with limited resources, you don't know how long it's going to take to have the right kind of authorizations. Coming back to the last company, we started clinical trials in France and a year after we started them in the US. I think, we have to be careful. The precautionary principle is important, and people who work in this sector are fairly responsible, but they're also driven by passion. So we mustn't set ourselves obstacles either. Once we've done the primary research, we need to quickly turn towards outside investors. And once you've got through that phase, well, the difficulty for me today is being innovative at hospital level, and also looking into reimbursement possibilities. Reimbursements can be complicated. Systems have been created, like the innovation set price. Not one product has been through that system. Are you talking about American products? No. The innovation set price, for this new system, not one product has been through it. So it's a shame, because we have doctors, top quality doctors, we've got some great engineers, we've got some great researchers, we've got tools for financing these phases, but as soon as we get to the market, you have to go elsewhere. So it's not a very virtuous circle because we've all made these investments, public, private investments. We've all invested a lot of energy. But then we have to look for investments outside, mainly in the United States, in China more recently. So these products then go back into the healthcare system in France after going outside, and they're probably at a higher price, but perhaps it's better structured as well in this way. So what you're saying is that, and I'll hand over to Cyril Limon, it's less a problem of money in the strict sense of the term, given the phase that you've just been describing. It's the fact that all the administrative machinery means that we are prisoners of this approach and we're penalized by it. Cyril, do you want to say something about this? Yeah, I think it's a great example of how research and innovation, and we've been talking a lot about open innovation and cross-innovation, so we're stakeholders of such projects. Why not be a stakeholder of that project as well, though? So MSD, in front of 500 people, says that they might set up a partnership with So you've talked about two major challenges. We're all trying to reduce the cost of research and to speed things up, because this is what we were saying yesterday. There are the challenges of the sustainability, and you talked about the pre-competitive stage. That is very important too. And I was a stakeholder in a project where many laboratories invested funds at a very pre-competitive stage. It was an open source project. And in the development of technologies and tools, this means that you can go and find the means of reducing times and the cost of research, whether we're talking about, well, there are different labs that can take part in such a project. And this is what's interesting today. When you look at a company like ours, we have our own labs, of course, but we also have many partnerships, including in France. So it means that in the future you're going to be interested in orphan diseases and in sectors that are fairly niche-like sectors, and that effectively will not open up to considerable markets. Is that the logic of many companies in the drug business? It's not our strategy to look at orphan diseases. Other companies do it better. It's not our strategy. Do they do it a lot better? Well, it requires other skills. What about the prospect? Is it less important to earn money than focusing on chronic diseases? Well, this is a debate that we hear again and again. People have said to me, in fact, you're investing in cancer because it's become a chronic disease. Why has it become a chronic disease? Well, we're talking about an old debate here. We didn't start investing at the time of the Gauls, but for 100 years now, we've had research on cancer. If we talk about immuno-oncology, we've been doing research in this field for about 30 years or so. So research has speeded up. If we take one of the next frontiers, we all hope in this room that we'll be able to do something about it, and that is Alzheimer's disease. Between 1998 and 2012, 128 trials were carried out, and there were 124 failures. So in this field, things have been launched recently. Products have been very widely circulated, but we realized then that they didn't help. No, they just dealt with the symptoms. Now, coming back to these subjects, Melis, Thomas is talking about the needs for investment. They're not huge for seed funding, but which the needs may grow, because in the incubator of projects, you've got projects emerging, and of course additional funds will be required. How can you intervene? I'm sorry, I'm here just to provoke you. Isn't there a trend? Isn't there a tendency don't we see investments in favor of certain companies rather than others, companies that don't necessarily need the money? Wouldn't it be, what is your approach? How do you judge, how do you evaluate projects and decide to help with them, invest in them? How do you go about taking your risks, even if the money of the BPI is yours, not the state's? Yes. Well, coming back to the companies in question who perhaps didn't need so much money, BPI France supports all French companies, but more importantly, it focuses on a subject where there is a big risk profile, and it does this in different ways. It can help to finance companies as long as they don't earn any money. We give them sums or seed funds. There are not very many financial establishments that lend money to such companies that don't have a very solid business model. And then we add equity. And we do this in two ways, either indirectly, so this is what we were saying about investing in seed funds. That's something that we do indirectly. There's an advantage to this, but there is a drawback as well. It's fairly slow. And BPI France does some direct investment as well. Not very much, because that would disrupt the mechanisms of the market. But the idea is that it goes faster, you can speed things up. And what BPI France does compared to other stakeholders is that it is based on capital and passion. So when some private people need to have a quick turnover of their portfolio, even in the life sciences, you need a lot of time to develop a new medication or provide a new device for the market. There are actors who are increasingly in a rush, and there's instability in relation to the capital. This is what BPI France can do. It adds capital, stability, and passion. So this means that more risks can be taken on board compared to other funds. BPI France helps companies to find enablers and help with projects with investment needs. I'd just like to say a couple of things. You're all saying that investing in health is a good idea. It's a good idea because the adventures that we've heard about are marvelous. We need such adventures, that it is possible to make money, that you can do that in an original way, and you can find financial backers. But how can we go about making sure that there are more? There are more experiences like this, because not in France there's the world market, yes, but in France, how can we be more efficient? You've already told us about a number of routes, but how can we go about this? You're both young. How can we encourage young people to adopt this kind of approach for medical devices or for specific materials? Yesterday we had a young GP with us. We know very well that young people are very cautious about investing. They don't want to invest considerable sums. What do we need to do to make young people want to do this? You know, you might accompany such projects. How can we encourage young people to invest in health and for it to be considered not to be considered as making money off disease? And how can we make sure that people see it as a legitimate approach? How can your example be followed? For example, while investing in health, we don't have a choice about that. In the healthcare system today, we have a financial problem. And to solve that kind of problem, we need to innovate. We need to innovate in technologies, in services, in organization. And I don't think today, well, we've got these silos, what's happening in hospitals, what's happening in society, and the technologies. I don't think we can, how can we go about organizing all of this? We need to push for more private-public collaborations, each with a role to play along the chain. I think that young people are highly creative. They're less fearful of entrepreneurship. They're attracted to that, so we need to show how it can work and make them want to try it out. And then, of course, we need relays with bigger companies. When we have something that changes the life of a patient very quickly, as many patients as possible must have access to this. For small structures, it's very complicated. It's like the valley of death. Financing is difficult. There are industrial partners who are much better structured to do this kind of thing. And we mustn't forget the healthcare system. We haven't talked about prevention, but this is another area where many things can be done.
Yes, indeed, we have to break down these silos, whether it's the funds. We shouldn't have just this innovation capital, but we have to have the definition of the needs first and then show examples where the community can work all together, and it can. Thomas, how can you help young people make other people want to do it? Other young people want to do it. Well, you have to show that it's possible. If you're below 30 this year, the world of opportunities that you have to personally launch this type of scientific, technological entrepreneurship is quite small. If to set up a startup today, generally, you have to have access to a laboratory. And to do this, you have to have funds. To have funds and access to a laboratory, you have to have proved your concept. So it's a loop where to have funds and to be supported, you already have to be a startup. So that's why most of the startups are often spin-offs. And we want to change things here. We want to show that you can bring this garage spirit into this sector and bring in the youngest possible diversity of people to start experimenting earlier and create this mindset and show them that they don't have to wait to have a PhD to start to launch projects. If I hear what you're saying, it's indeed what you've done in terms of medical devices and drugs or other sectors. You need these people capable of imagination to set up systems of the same type. Yes, in your conclusion you said, I don't wake up in the morning looking at profitability or looking at the idea of making money. My reality every morning is saying the innovation challenges are a company that adapts. Then there's a certain profitability, yes, that has to be reached. But if I only thought about profitability, I wouldn't invest in antibiotics, for example. Now, we talked a lot about how. Let's talk about where. Why invest in France? Is that a crazy idea to invest in France? I think that's a real question. When I take the company that I manage, in the past 3 years, we've significantly grown our investments in France. And there's always this opposition between wanting to promote, and we should promote this. I've traveled a lot. I think we have one of the best research ecosystems in the world and one of the best healthcare systems. So the potential is unbelievable in France, and I agree with you. However, for a large group with investors, at a given moment there must be a balance. And we're reaching a very important stage, and we debated this yesterday, which is to give ourselves the means to continue to develop this research and healthcare ecosystem. And we need to find a balance. This balance will be achieved thanks to a certain number of rules that remain sustainable. The huge challenge today in France is the constant changes in regulations and legislation and the rules to assess what we contribute and its value. We know how to work in a closed envelope, but what we don't know how to in a closed environment, but we cannot work in an environment that's changing every year. Now, how can we accompany all of this? You have a tool. You are a tool that's been created by the French state. You've heard these comments that are being made. You hear them every day through the companies that you're helping. How can the BPI, the president or the general director, what do they do to relay what you hear to the Ministry of Economy and Finance to say less rules, less absurd rules, to ensure that there are 3-year plans, for example? Are you involved in this communication? There is a real relay, I think. Well, my general director, my general manager, works on this on a day-to-day basis, but he has placed a huge focus since the creation of BPI France on supporting entrepreneurs. This is the topic between 2013 and 2016, what we've essentially been focusing on is doubling our financial resources, whether it's banking or investment financing. And we're going to stabilize this now and now focus on supporting entrepreneurs. And all of the success stories such as La Paillasse are an excellent illustration of the fact that young people want to undertake this type of adventure. I'm happy to see that there's an incubator at the Polytechnical University, and that didn't exist just a few years ago, and we can help them. Now, I think later we will have a visit from Emmanuel Macron, former Minister of the Economy. If you would like to ask him one thing, if you have one thing to ask him as a candidate, well, for me, it's really our companies should be present in the local market to be stronger in the international market. He needs to help us. We talked about this fungibility of budgets to accompany the transformation of the hospital and innovation in the healthcare sector. What would you ask him, Thomas? For me, I would clearly propose support as early as possible to young entrepreneurs who should have the same status as students. If we can help students with scholarships, why shouldn't we be able to help young entrepreneurs who are taking the same risks? They're investing in themselves without making any money. Thank you. I think we're on time. I hope we've managed to answer the question, but thank you for making us want to and stimulating our thought. Thank you. Thank you.